So next we're going to be talking about asthma severity and classifying what asthma severity looks like by Elizabeth Locker. So there's a couple of different levels of impairment when it comes to asthma. The key being the severity of them being impairment or risk. And then the severity stages are intermittent, persistent, or it could be like mild, moderate, severe, just depending. So this slide and the next slide are pretty similar. I kind of break it down more in this slide, but basically intermittent would be asthma symptoms that are less than or equal to 2 days a week of symptoms. So maybe the patient, has kind of an on and off cough, an on and off kind of dryish cough, and it only happens like a couple times a week. That would be, intermittent symptoms. Persistent would be like on a regular basis, so it could be daily, it could be, every week at, or every week, like on the weekends when the patient gets stressed or drinks or comes into contact with an environment that exacerbates their symptoms, or it could be like throughout the whole year. It just really depends. When it comes to medication use, we also want to look at lung function. So I didn't put like a diagram or anything in here, but we often look at like the FEV1 and the FEV1 / FVC ratio, and the asthma guidelines, the little pocket guide that I talked about in the last video, that has kind of specific guidelines that breaks down like if the percentage, like let's say they're 80%, and their FEV1 FVC ratio is 75% or whatever. It kind of breaks down like the level of severity and what that is going to look like for that patient, just depending. And we want to look at that because then we can kind of have a guess for gradually if the medication is working, right? So when we talk about like short-acting bronchodilators, a lot of times we're talking about rescue inhalers. And Asthma can be very effective and very helpful, but we really want to know how often is this person using this, right? And is it avoiding them having an exacerbation? Is it avoiding them having, decreased lung function or decreased compliance? So a mild use would be if they only have to use their SABA once or twice a week. Moderate would be like pretty much like every day on a daily basis. And then severe would usually be like they have to use their SABA, 2, 3, 4 times a day. So when we're talking about the hospital, that's typically why we'll do like Q4, Q6 treatments, just depending on the patient and how like severe that they are. This isn't another way that you can kind of look at this too is it affecting my daily activities? Is it affecting my daily living, right? So if it's affecting the patient on a regular daily basis, then it might be, more severe because it's affecting their ability to function normally. If it's affecting them like once a week, where once a week they have, such bad drainage at night that they can barely breathe, but then, every other day they're kind of okay. So maybe they're eating something that's exacerbating their symptoms, or they're around someone, or some type of perfume or something. So it's just kind of looking at those variables and then kind of figuring out like, okay, what is the underlying indicator here, and how can we improve this patient's overall quality of life? So lastly, let's talk about risk. So risk is really it's really defined as the number of exacerbations per year per patient. Yeah, so like let's say the patient has 6 exacerbations per year, but 4 of them are mild and 2 are severe where they have to be hospitalized, right? Because someone may have an exacerbation, and it obviously affects their quality of life, but they may get by not being hospitalized, or only maybe going to like an outpatient, like seeing their like pulmonologist or something. But when we look at risk factors, we can kind of really get, you know, an underlying number. Like Medicaid kind of, they run like numbers specifically on patients and give them a severity rating based off the number of hospitalizations. So this is kind of the same thing. Mild would only be like two times or less per year. Intermittent is less than or equal to 2 exacerbations in 6 months. Or wheezing greater than or equal to 4 times per year lasting longer than 1 day. So it's basically the same as what I just said, just in a different way. And then I included this picture. This is from the pocket guide. I really like the pocket guide. It has like a lot of information and it breaks it down really well. But it just kind of goes over the management of asthma exacerbations in primary care. And kind of like shows like mild or moderate, severe, life-threatening. And then when to like assess for discharge. So I really like that. I'm sorry if it's hard to see. You might have to kind of zoom in on it, like, or you're welcome to screenshot it if you want. I'll also include the references in the next video if you want to go ahead and look at the pocket guide. Alrighty, thank you so much for watching.